Hello, I am urologist Omer Erdamakaya. Today I will give you a short video presentation about what is late-onset testosterone deficiency, its treatment and symptoms. After the age of 40 to 45, if testosterone is below 300 ng of DL in the blood and the patient has obvious complaints of loss of sex drive and fatigue, we call it late-onset hypogonadism condition. What does testosterone do in the body? Testosterone is one of the most important hormones in the body that provides sexual power, desire, reproduction, muscle strength, muscle volume, consumption of fat tissue and bone density. Its deficiency may cause complaints such as decreasing erection strength, fatigue, poor concentration, irritability, mild depression and short temper. The reason I said may cause is that sometimes, even if the testosterone level is below the levels I mentioned, the patient may not have any of these complaints. In other words, just because the testosterone is low does not mean that the patient will have these complaints. But if the patient has both low testosterone and some complaints, we see a significant improvement when testosterone treatment is used, and a dramatic improvement in their complaints. What kind of results do we get in patients when we use testosterone treatment? First, there is an increase in erectile potency and sex drive and desire. There is an increase in muscle tissue and volume, a decrease in body fat, and an increase in insulin levels. On the other hand, there is a significant increase in the patient's body resistance and resilience. So, there's no harm in that. If the treatment is done uncontrolled, it can cause shrinkage of the testicles, enlargement of breast tissue, gynecomastia, some enlargement of prostate tissue, and rarely, if done outside of urological control, it can cause silent prostate cancer. The spread of testosterone therapy has increased significantly worldwide in recent years. This is because the results are really good. But as I said, this treatment should be done under the supervision of a doctor. However, I think the most important point is, under what conditions can we increase or decrease endogenous testosterone, without external testosterone, under normal conditions? It is important to know this. This will be the topic of the next video presentation. If you have any questions, I'll be happy to answer them in the comments section. Thank you so much.